Horner's syndromes. So let's see the sympathetic pathway of the eye. There are three types of neuron: first order neuron, second order neuron, and third order neuron. From hypothalamus to the CAT2 is first order neuron. From the T2 to the superior cervical ganglion. From T2 to the superior cervical ganglion is second order neuron, the green part. And from superior cervical ganglion to the pupil dilator muscle is third order neuron. So this sympathetic nerve supply is consist of three order neuron: first order, second order, and third order. And this sympathetic muscle supply the pupillary dilator and causes dilation of the pupil, that is mydriasis. There is first order neuron from hypothalamus to the CAT2, second order neuron, that is CAT to the superior cervical ganglion, and third order neuron, the superior cervical ganglion to iris dilator muscle. So let's revise one next time. First order neuron hypothalamus to T2, second order neuron from T2 to the superior cervical ganglion, and from third order to superior cervical ganglion to the pupillary dilator, which causes the pupillary dilation, that is mydriasis. So what is Horner's syndrome? Horner's syndrome is the damaged sympathetic neural pathway. Damaged sympathetic neural pathway of eye associated structure, that is the sympathetic pathway damage. So it may be damaged in first order, maybe in second order, or it may be in third order. That is, it may be between hypothalamus to CAT12, or between CAT2 to the superior cervical ganglion, or from superior cervical ganglion to the pupillary dilator muscle. So this is called Horner's syndrome, that is the sympathetic neural pathway damage to the eye. So what is the symptom? The mnemonics for the symptom is high maple, HIMAPLE. For H, the symptom is heterochromia iridis, that is two type of iris color is seen. This one is lighter and one is deeper. The color difference between two iris of two eyes, this heterochromia iridis. From I, inferior eyelid elevation due to paralysis of inferior tarsal muscle. Due to paralysis of inferior tarsal muscle, the eyelid of the inferior tarsal becomes elevated. This from the normal position it goes to the hair. Normal position goes to the hair. And the meiosis. So here the dilator pupilla is the sympathetic supply. So due to the damage of the sympathetic supply, there is a paralysis of dilator pupil muscles. So as a result, the pupil remain constricted. So this is called meiosis. From a anhidrosis, because due to anhidrosis means no sweating, because due to impairment sympathetic innervation of the facial sweat glands. Sweat glands are supplied by the sympathetic nerve, and here the sympathetic nerve is damaged, so the sweat is not produced. From ptosis is the drooping of upper eyelid, that is upper eyelid depression. So the inferior eyelid is elevated and the upper eyelid is drooping, so the eye becomes so small. So why the drooping occur? Because the molars muscles is supplied by the sympathetic nerve. From L, the loss of ciliospinal reflex, and E from inophthalmos, that is the sunken eyeball. The eye becomes sunken between eyeball. There is 7 symptoms: heterochromia iridis, inferior eyelid elevation, M meiosis, A anhidrosis, P ptosis. The most important is 3: meiosis, anhidrosis, and ptosis. A loss of ciliospinal and inophthalmos. The damage may be in first order, in second order, or in third order. The damage of first order neuron is caused by the 4 main regions. The first main region is brainstem stroke. It is also called Wallenberg syndrome. It may be meningitis, demyelinating disease, there is multiple sclerosis, or brain tumors. The second order neuron damage may be caused by, most important is Pancoast tumor, common carotid artery dissection, and iatrogenic cause like bath trauma, central venous catheterization. Then next, third order neuron, that is postganglionic neuron damage. It caused by the dissection of internal carotid. Remember, this is the common carotid and this is the internal carotid. And cluster headache and herpes zoster infection. So here is the herpes important, and here is the Pancoast tumor. There is second order neuron damage. So most important second order is Pankos tumor, and third order herpes. Now what is the diagnosis? Diagnosis is done by two tests. First is 4% cocaine test, and second is amphetamine and adrenaline test. Cocaine test is used for diagnosis of Horner'S people, and amphetamine and adrenaline test. Amphetamine and adrenaline test are used for the localization of the lesion, that is whether it is first order, second order, or third order. So how 4% cocaine test is done? First, 4% cocaine eye drops is done on eye. Cocaine is a pupillary dilator, that is it blocks the reuptake of norepinephrine into the synapse of postganglionic sympathetic nervous and muscles and stimulate the sympathetic pathway. So if the pupil dilates, that is stimulation of the sympathetic system, that is it is normal pupil. And if the pupil does not dilate, so it is a Horner's pupil, because the sympathetic system does not work here. So next test is amphetamine test or adrenaline test. So it is useful for the localization of the lesion, that is where the lesion is occurs, first order, second order, third order. So if the Horner's pupils dilate, that is the lesion is on first and second, it may be first or second, because the Horner's pupil, if dilation occurs then first and second, if not dilation then third order. And what is the treatment for this disease? So there is no such treatment. The treatment is that treat the underlying cause, for which it is caused, that the underlying cause may be here brainstem Wallenberg disease, meningitis, demyelinating disease, or it may be Pankos. So treatment for this available, and this. Thank you. See you in the next video.